Hi, this is Dr. Rajeshwar from Yerra Pharma Tube. In the last lesson, we learnt the definition of an antibiotic and some commonly used terms. The link is given in the description below this video. Watch it. In today's video, I will tell you about the historical background of antibiotics. History of antibiotics. There is an evidence of antibacterial herbs or potions being used for many centuries. For example, the Chinese used moldy soybean curd to treat carbuncles, boils, and other infections. Greek physicians used wine, myrrh, and inorganic salts. In the Middle Ages, certain types of honey were used to prevent infections following arrow wounds. Of course, in those days, there was no way of knowing that bacteria were the cause of these infections. Bacteria are single cell microorganisms first identified in the 1670s by Antony van Leeuwenhoek following his invention of the microscope. It was until the 19th century that their link with disease was appreciated. During the later half of the 19th century, scientists such as Koch were able to identify the microorganisms responsible for diseases such as tuberculosis, cholera, and typhoid. Methods of vaccination were studied and research was carried out to try and find effective antibiotics. During the same time, Robert Koch and Louis Pasteur proved that diseases can be caused by germs and or microorganisms. Pasteur developed two approaches. The first approach was to use harmless bacteria to cure diseases caused by harmful bacteria. Today, we can explain those observations. Those harmless bacteria probably produced antibiotics that killed the infecting disease-causing bacteria. The second approach was to use chemicals to kill the bacteria, giving rise to the process called chemotherapy. The scientist who claimed to be the father of chemotherapy, the use of chemicals against infection, was Paul Ehrlich. Ehrlich spent much of his career studying histology, then immunochemistry, and won a Nobel Prize for his contributions to immunology. In 1904, he switched direction and entered a field which he defined as chemotherapy. This was started by Paul Ehrlich, who understood that the first step of chemotherapy must be binding of the chemical to the bacteria. This led to the testing of dyes as antibacterial agents because they were known to bind bacteria. After testing numerous dyes, Ehrlich found one in 1904 that could cure mice infected with trypanosomes, that is, the sleeping sickness disease in mice. He named the dye Trypan Red, which was the first chemotherapeutic agent discovered. The structure is given here. Trypan Red was later shown to have antiviral activity. In 1932, another antibiotic discovery was made by Gerhard Domack while testing other dyes. Arsenical compounds constituted another class of drugs used as chemotherapeutic agents. The first arsenical drug was arsenilic acid, discovered in 1863 by a French chemist Antoine Béchamp, who named it as atoxyl. It was widely used as a cure for the protozoal disease of sleeping sickness, that is trypanosomiasis, in the early 19th century. However, it was observed that the protective effect of atoxyl was only temporary, and in the end of the parasite reappeared even if the dose was increased. Also, the drug was highly toxic and eventually resulted in the death of the patient. By 1910, Ehrlich had successfully discovered the arsenal drug salvarsan, which was effective against trypanosomes and also against the virus that causes syphilis and was less toxic than atoxyl. However, it was still significantly toxic but remained the drug of choice for the next several decades till it was replaced by penicillin in the 1940s. Over the next 20 years, progress was made against a wide variety of protozoal diseases, but little progress was made in finding antibacterial agents until the introduction in 1934 of proflavin, a drug which was used during World War II against bacterial infections in deep surface wounds. Unfortunately, it was too toxic to be used against systemic bacterial infections infections, that is, those carried in the bloodstream, and there was still an urgent need for agents which would fight these infections. This need was answered in 1935 when it was discovered that a red dye called prontosil was effective against streptococcal infections in vivo. It was recognized eventually as a prodrug for the synthesis of a new class of antibacterial agents, that is, the sulfa drugs or sulfonamides. The discovery of these drugs was a real breakthrough as they represented the first drugs to be effective against systemic bacterial infections. In fact, they were the only effective drugs until penicillin became available in the early 1940s. Although penicillin was discovered in 1928, it was not until 1940 that effective means of isolating it were developed by Florey and Chain. It was revolutionized the fight against bacterial infections and proved even more effective than the sulfonamides. Despite penicillin's success, it was not effective against all types of infection, and the need for new antibacterial agents still remained. Penicillin is an example of a toxic fungal metabolite that kills bacteria and follows the fungus to compete for nutrients. The realization that fungi might be a source for novel antibiotics spurred scientists into a huge investigation of microbial cultures from all around the globe. In 1944, the antibiotic streptomycin was discovered from a systematic search of soil organisms. It extended the range of chemotherapy to the tubercle bacillus and a variety of gram-negative bacteria. This compound was the first example of a series of antibiotics known as the aminoglycoside antibiotics. Penicillin was the first scientifically studied antibiotic. However, it was not the first recorded use of antibiotic. The Greeks were known to use extracts of male fern to treat worm infestations. Extract of cinchona bark was used in Peru, Bolivia, and Ecuador to treat malaria as far back as the 16th century. The active component of the extract was later shown to be quinine, which was the only available anti-malarial drug until the 1940s when chloroquine became a more popular drug of choice. However, quinine is still recommended for the treatment of malaria. In 1888, Freudenreich discovered that pyocyanase, a blue pigment secreted by Pseudomonas aeruginosa, had antibiotic activity but was highly toxic for the host. Ipecacuanha root was used in Brazil to cure diarrhea and dysentery. Emmetine was isolated as its active component in 1817 and was shown to cure amoebic dysentery. After World War II, the search continued, leading to the discovery of chloramphenicol in 1947, the peptide antibiotics bacitracin in 1945, the tetracycline antibiotics chlortetracycline in 1948, the macrolide antibiotics erythromycin in 1952, the cyclic peptide antibiotics valinomycin, and the first example of a second major group of beta-lactam antibiotics, that is cephalosporin C, in 1955. As far as synthetic agents were concerned, isoniazid was found to be effective against human tuberculosis in 1952, and in 1962, nalidixic acid, the first of the quinolone antibacterial agents, was discovered. A second generation of this class of drugs was introduced in 1987 with ciprofloxacin. Many antibiotics are now available, and the vast majority of bacterial diseases have been brought under control, for example syphilis, tuberculosis, typhoid, bubonic plague, leprosy, diphtheria, gas gangrene, tetanus, and gonorrhea. This represents a great achievement for medicinal chemistry, and it is perhaps sobering to consider the hazards society faced in the days before penicillin. This is the list of references followed for the lesson. That's all in this video, the historical background of antibiotics. In the next class, we will discuss the beta-lactam antibiotics. Till then, never stop learning and never stop watching my videos. Thank you for watching this video.